on this episode of A Tale of Two Hygienists.
I think in today's technology, we can do better in helping our patients understand what we can do and what you can separate. You could pull, if people are diabetic, sending them down a funnel of communication in which you've got to understand we can help without a pill to get your diabetes better controlled by having a healthier mouth. How it's connected. You're trying to have a baby. If you got a healthier mouth, you can carry a baby full term.
Hygienists need to empower themselves and be the hygienists that they want to be. And there are opportunities out there for them to do that. It's being confident enough to leave the place that you are that you're not happy in. And I know every hygienist can't do that. I know that there are hygienists that have to be where they're at because they're in a small town, or they can't find another job, or they're a single mom, or I know there are reasons. But I also feel that there are ways that you can personally empower yourself, get back to treating your patient as a patient.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 486. I'm your host, Andrew Johnston, and thank you so much for joining us today. In this episode, we have part 2 of the 2-part series that we started last week, featuring Nies and Rafael Rondon. We also have co-host Jackie Sanders on the show, and we talk about several topics, including if there is room for dental assistants to take over some of our responsibilities. It's a super hot topic right now with some legislation passing in some states. And so there were some very interesting takes on this episode. Conveniently, on another of our shows here at Endeavor Business Media called Dentistry Unmasked, Dr. Pam Ragliana-Muñez and Dr. David Rice also talk about this topic with guest Dr. Mia Geisinger and Katrina Sanders. If you haven't checked out the show yet, you really need to. Katrina actually is from Arizona, where some of this legislation has passed, so they have some interesting takes over on that show as well. But this is an episode with Liz and Rafael that you're just going to really love. And like always, if you have any questions, be sure to reach out to our guests. I have the emails and phone number for Mr. Rondon in the show notes, and Liz's email as well. So be sure to give them a shout if you have any follow-up questions. That's all for us for this week. Thanks again for listening, and enjoy this episode.
A tale of two hygienists.
Can we shift off of the clinicians for a minute, and can we talk about the patients? Because I feel like the behavior of patients has also changed, over the years. What are we seeing in, I guess, the recent years in behavior of either are there more no-shows than ever before? Or are they more demanding? Are they what are we seeing there, Rafael?
It all depends. I think the younger folks are coming in, they're more willing to be there and come in and see their service because they're healthy. They're coming in and they're coming in because they have more knowledge now. They come in with more information than perhaps the older folks at one time, like when I graduated in 1990, they didn't know the difference between gum disease or healthy. That was not, you couldn't go and Google it at that time. And I think now patients that are younger, they come in with more information. They have more knowledge on certain things. So to me, it's easier to communicate with them and try to get them to maintain that visit because they know it's to maintain their teeth. That's all they want, is what looks, compared to older folks. And also then, of course, we have to deal with insurance and what insurance does with certain patients because they feel like every time I go, I might have to pay something and not willing to pay for anything. I'm expecting my insurance to cover for everything, cover every service. And that stops them also from coming because they feel they're going to come in and there's going to be a charge and I don't want to pay for it. I have to save my money.
So it's interesting. I just had a conversation with this doctor the other day about insurance, and he's just like, man, I can't believe it's still the same as what it was 40 years ago as far as the benefit or whatever. He's like, it's just a joke. He's so fed up with the insurance. I'm like, yeah, your patients are too, man. Like they want more too.
Yeah.
It's not insurance.
Yeah.
It's a benefit.
No, it's not.
It's a benefit.
Exactly.
And we try to schedule in my organization, we try to push to schedule 10, knowing that maybe 6, 8 will show up. So we try to do a little more just because of that fact that, and then we're trying to make sure that we have the time to take care of those because if all 10 decide to show up, those are the moments that you feel like, oh, how am I going to do this one? And the U.S. hygienist, you can imagine it becomes a little bit crazy to try to ensure that you're assessing the patient, getting information, getting the diagnosis, doing the treatment plan, and the patient wants to leave with their gum therapy completed. And of course, you only had an hour, and that means you have time to do it. So that becomes another issue with the patients as well.
What tools do you guys have for communicating to the patient about their appointment? You guys just do text? Do you still make calls? Is it robot calls?
Yeah, and then we have text message. They receive 2 days prior, a week. If they don't confirm, with 2 days before, and even a day, that same day they get a message as well.
I wonder how much, like, you remember getting the postcard, like, hey, don't forget your appointment is on 2 weeks out, and everyone's like, all right, we're gonna put it up on the fridge, and we're never gonna forget it, and we just go to it. Man, maybe that was a simpler way of, I don't know. It just seems like that was more of a commitment.
It was, and it was written by the hygienist. I can't wait to see you and all that. So there's a little more connection. I mean, we've lost.
I think it's the memory of that. I think
so?
but you're right. When you think back, it's like all the honeymoon stuff. Oh, wasn't it great? But the reality was you have to get a postcard. It has to go in the mail. How many people actually get their mail? Does the mail come?
Yeah,
that's true.
I think in today's technology, we can do better in helping our patients understand what we can do and what you can separate. You could pull, if people are diabetic, setting them down a funnel of communication in which you've got to understand we can help without a pill to get your diabetes better controlled by having a healthier mouth.
Yeah.
How it's connected. You're trying to have a baby. If you had a healthier mouth, you can carry a baby full term. I think we can do better with today's technologies. And I think with today's technology and AI, maybe we can finally get away from the pointed metal stick, because I think the pointed metal stick is old technology that's read different by every single person. And we have a better way of telling how disease is. And quite frankly, I think the only reason the pointed metal stick still exists is because insurance, you need to have the probings to get it covered. That's my own personal opinion on periodontal probing.
No, I think the thing is, I think you're right on that, Liz. And here's why I get all excited. Like, I'm all animated now all of a sudden. The rock star is speaking in, guys. Well, it's because I just went and I did my eye exam, right? And they do the little check. It's no glaucoma or whatever it is, a little puff in your eyeball. And it's like, there's got to be something that measures pressure and measures something that is air driven, that's comfortable, that's something that can, we said this forever, I don't know how many, a decade ago, but something that can go intraorally and just scan and just be there. And whether it's multiple inputs of like pressure and gets all this, there's got to be something that can read the ligaments. Like at this point, are you telling me there's not?
It's creative. We have to do something out there to try to help the hygienists out there. But I think based on what Liz was saying, so AI to me shows levels of bone locks. So that right there is a great way that, okay, I'm seeing here through the x-rays, you have X amount of bone level that's gone down. Based on this and you're bleeding, you have an active infection, it's getting a root pain without having to do probing. And patients will start thinking, you're poking me, or you're making that pocket bigger by poking in their like mindset of patients. So I think that to me, they should use AI as what it is and stop letting insurance continue to drive what we do in the practices.
How great would it be? I think I've mentioned this a long time ago on one of the shows, but like, you go into an office, right? And then, you know how Crest Orb always has like the toothbrushing station at Chicago Midwinter, right? Like they can go in, okay. So there's one station, okay, you go in there and you just bite down on a thing, and like it does all of your x-rays, it does all of your imaging, it does all of your scans, it reads your existing restorations and pops them in there, it reads the decay, like it reads everything that we're looking for in a 30-second thing. And then of course, we have to disinfect that area, and then the patient continues to wait in the waiting room. And then when we're ready and had an opportunity to like interpret all that information, we bring them back and we can have a full conversation until we get to the point where it's like, Liz was saying, like, okay, now here's something that they filled out in the medical history, and here's something from the scan. Now AI is going to just give you all the information about that condition without us even having to talk to them about it.
Yeah.
That'd be great. That'd be, you know how much time that would save? And we could just like focus on the prevention aspects.
I think you just
and
described the hygiene appointment, though, really, currently.
Basically. I mean, the bots still can't do our job yet. So I think we're still going to be okay for a few more years, a few more decades.
But I think
But-
that's the problem. We're so stuck with the old way that we're doing things. The old is still the gold standard and they're stuck in it. And that's what they're being taught in school. And that's what what we're bringing out from school.
Yeah.
And we've evolved so much. And so when you're a DSO and you're trying to bring them to the next level, the people that they respected the most taught them this and not bridging the two together.
Yeah.
And growing and saying, I could work with an assistant scaling if it was above the gum line. If I said this patient scaling here, I'm going to go in here and I'm going to treat this infection. I can see a model like that in the future because in my mind, it's not all about scaling everything off the teeth. I have such a more vital role to play for that patient. Yeah. I'm assessing, I'm realizing, I'm talking with them about other treatments. What's best for you 20 years from now? Not just today that you walked in here, but how can I help you have a better life today and tomorrow? And that's to me is so much more fun than get every piece of calculus.
I think you're right. I think the model's been proven. We have several states that assistants do restorations now. And I remember when that came out in our state, it can be the end of the world, right? Because it was hygienists that did restorations in that state or dentists, right? Obviously, but that was our job and blah, blah. And then they thought it was going to be like, all right, well, we're going to lose it slowly, like constrict that scope. Well, they end up doing beautiful restorations. There's only a handful of them that actually wanted to do it anyway. And so it was like, didn't end up being that big of a deal. So if there is a model where they can safely do this other aspect, that's not really therapeutic, that is just kind of just take this part off our plate while we do the real important stuff. I agree 100%. I'm not too worried about that. I know legislators won't let that happen exactly like that. And that is kind of the concerning part. But the model, I think what you're saying, Liz, is exactly right.
I don't know. I think it's the time that we just have to, as those that are seasoned in this profession, remind people why they're here, why they're in this profession, and create that better space. And I don't have the answer on how to do that other than how I'm doing it currently for myself. But I think people are looking for it. I think people don't want to leave this profession, but they do out of frustration.
I totally agree. And not being able to work to the fullest of their licensure. I think they're probably tired. They're completely tired of doing the same thing every single day. Patient in, patient out. And that's what's making this career, this profession, kind of drain itself out.
I'm going to jump in here. I haven't said much because I've been biting my tongue. Hygienists need to empower themselves and be the hygienists that they want to be. And there are opportunities out there for them to do that. It's being confident enough to leave the place that you're not happy in. And I know every hygienist can't do that. I know that there are hygienists that have to be where they're at because they're in a small town or they can't find another job or they're a single mom, or I know there are reasons. But I also feel that there are ways that you can personally empower yourself, get back to treating your patient as a patient. The other platform I'm going to go down here is hygienists now are responding to dental assistants the way that dentists have been responding to us. Oh, no, dental hygienist, you cannot do this because it'll take money out of the dentist's pocket. Now the dental hygienist is saying, oh, no, dental assistant, you can't do this because you're going to take money out of our pocket. There is room for all of us. There are so many people out there needing access to care, whether it comes from a dentist, whether it comes from a hygienist, whether it comes from a dental assistant who may not do it to the caliber that a dental hygienist would, but they may be helping in their own way. I was an expanded function dental assistant in Colorado for many years, and I know I didn't do treatment as well as a dentist would do, but I was helping that dentist see more patients, and we did the best we could do. I think and I agree with Liz, not all dental assistants want to do this. Yeah. And I got looking as things started erupting here the last couple of months. Illinois has allowed dental assistants to scale patients under the age of 17 super gingivally for the last 5 years. I haven't heard any horror stories. I haven't heard any dental hygienists losing their job to a dental assistant. So I think we need to quit tearing everybody apart and get back to the fact that we could all work together. I worked dedicated 2 chairs with an amazing dental assistant in Utah that I would have trusted her to work with me. And if she would have had any questions about a certain treatment, she would have come and asked me. And I think there's an opportunity to embrace this and make it better. But instead, many of us, and I will include myself, are scared right now thinking we're losing our role and our importance. We're not going to lose our role as long as our patients know what we are doing for them. And so, yes, we can be scared. Yes, we can go after the Arizona governor that, signed this bill, or we can embrace this and empower ourselves for how much better we are at what we do than a few-hour trained dental assistant. But that's just my opinion, but I think we could try to embrace this with a positive response rather than a bunch of negative responses. That's my
All
story.
right, Jackie Sanders. Well, you were biting your tongue, and now we're gonna come after you. Here we go. No,
You're right.
You
here,
go right
oh,
ahead,
here,
come after me.
no,
I'm
actually, no.
the opinion of one, but I know that I know I'm just the one that'll speak up and say what I'm thinking. I
Yeah,
know that there's a lot of hygienists that won't.
yeah, but also, but I guess what you're saying, I don't have fundamentally any disagreement with. It's like what we're doing. All of this, what we're doing, we talk about it, but what is actually going to move the needle? So, in order for us to work together with dental assistants, in order for us to do all of these things, in my viewpoint, it actually is the problems are actually coming from what the dental offices are allowing their providers to do. Or whether it's mostly, again, I don't think it's so much DSO. I do think it's a lot mostly private practice. Private practices are mostly, in most states and probably 99% of the scenarios, owned and run by a dentist. They only want their hygienists to do X, Y, and Z procedures, nothing else. They only want their assistants to do X, Y, and procedures, nothing else. Is the tactic then, if we're trying to work together, is it to go and have a better relationship with the dentists and the dental association? Or is it, you're talking about, the public needs to know what we do, or is it we need to be doing campaigns to the public so they know the difference between a hygienist and assistant, and so they can, you see those things as, hey, make sure you request this kind of a certified someone to change your oil. I don't know, actually, but is it the same idea? Like, hey, make sure you're asking for a hygienist when you go to your appointment. I mean, what tactic do we take to fix these problems or these perceived problems?
Has to be both, Andrew.
Yeah.
Yeah.
Personally, I think the changes start within the office.
Mm-hmm.
And Liz said it. We need to be better communicators. Dentists are not good communicators. Hygienists aren't good communicators. We're caregivers. We do not like confrontation. But there is a way to talk respectfully and say, we could, because when it comes down to it, dentistry is a business. I hate to say it, but it is if the dentist isn't making money, nobody's getting paid. But the dentist has these responsibilities. Our hygienist has these responsibilities. Our assistant can now do some of these responsibilities, and we can work together to see more patients in the day. But I don't think the answers are going to come from the associations telling people what they have to do, because the majority of dentists don't listen to their association, and vice versa on the hygienist side. So I think the changes have to come from within the walls. And one of the reasons I brought up the things about the students is because personally, I believe if our students were mentored for a few months after they graduated and learned how to find the basics again and follow the time restraints, then they wouldn't become those burnt out 8 to 5 hygienists. They would know how to manage this beast that appears after you graduate from hygiene school that you don't know how to manage because nobody's taught you how.
Mhm.
Are you talking
Oh,
like
am I going to
like how
get
the
nasty
dentists do like a
when I listen to this?
you will. Are you? But that kind of sounds more like a residency, kind of like what dentists in New York, I think, have to go through like a 1-year residency post grad. Is that what you're talking about? Like, and it doesn't have to be a residency necessarily, like some sort of a boot camp where they're like, hey, after you graduate, you go through this
There's-
boot camp so you can get mentored and get the help that you need, and then here's procedures, here's products, here's all the different
Well,
things.
there you go, Liz and Raphael. There's you an idea. I mean, you don't have to, but I think it might be something that young graduates would embrace. I mean, I know that there are individuals out there right now coaching and consulting with new graduates, and they're doing very, very well with it because these individuals put so much money into getting educated. We know, we all four know that energy level when you graduate and you're ready to go out there and take on the world. But if you land in a bummer office as your first office, that balloon gets popped really quick.
Where you-
So
Yeah.
let's help our new graduates not pop their bubble in the first month.
Mhm. Well, it's true.
Seriously. Would that be something, Raphael, that you, I mean, and obviously you can't speak on behalf of your company, but like, is that something that you would imagine a DSO could do? Is because we do onboardings and things like that. I mean, but could they do something? Hey, new grads are going to go through 2 weeks back at the home office and just like really drill down on all that stuff.
Yeah,
More so than like orientation.
yeah, definitely. I think to me, the DSO will be easier to perform something like this because as we continue receiving new hygienists, it's a good or a dental assistant, is aligning them to the protocols and the process and what they could do, what can we do. It's kind of creating that process. I think it's going to be very easier for DSO than probably a general practice that has so many dentists, and that person is not going to create a protocol or things like that to align who's going to do what in the practice. So yeah.
Mhm. I wonder if this could also maybe be like part of a school setting, because no one wants to pay for their board exams. Like, why would they want to pay for the 6-week or however many weeks, next step bridge program to get them, up and running? But like, even if our colleges and universities, if they were saying, hey, stick around for 3 weeks, we're going to have someone outside of us. It's part of your tuition already, but someone outside of the school is going to now onboard you or whatever we're calling it, train them to get the thing that they need. My brain's in like 5 different places right now. Like what? Well, because it is the new grads. All of this is right. We need these people to be engaged and love it and want it so bad. And I just, unfortunately, I don't feel like it's the same that maybe it was, when I graduated. I feel like we all wanted to be a hygienist so badly. And we sacrificed and we worked so hard.
Well, it
And
was
when we
harder to
got
get
it,
into
we wanted it.
hygiene school back then too, right?
Yeah.
I mean, it was
Yeah.
small classes. It was, you felt honored to be in it.
Mhm.
So it
Mhm.
started there. And I feel like there's almost a bait and switch that happens. We promise while we're in school that this is going to be the utopia. This is what you have. And then all of a sudden you get into private practice or DSO and it's totally different.
Yeah.
It's like you no longer have somebody checking you and you've got to do it faster than you ever did before. And you kind of lose that passion. And so Jackie's right. It's up to each individual person to be able to want to be more. Like we went to Career Fusion, right? Woohoo, I have to say Career Fusion changed my world. And that was moving from chair to something else. But it made me a better clinician when I was in the chair. And I see hygienists wanting to be more, and they just don't know how to do it. So, maybe we have to look to under one roof to creating something for new grads, Jackie. I'm going to call you out. Maybe we need something like that has this thing, new grad seminar, be all you could be. And it's a day course to just light the fire and see what happens. But I think we also have to call our schools into play and say, it's up to you to teach the business of hygiene, that giving great care will provide the money you need if you follow the guidelines that are in place. And that's why I love DSOs, because they have this protocol that if you follow it and treat the disease as it should, your patients will be healthier and the practice will be healthier. And you don't have to worry about that monetary amount because you're doing the right thing and you're helping people get there through financing.
Yeah. I mean,
It's not all by insurance.
yeah, I agree. I think that will be an important piece to do because either from the school setting or if Jackie, you want to start something different. I
Yeah,
feel
let me start one more thing.
I think it is
Yeah, time.
important because hygienists come out thinking one way and they get overwhelmed very quickly. Is it this? I didn't sign up myself for this. This is not what I didn't know, needed to know X and Y. Now, why do I need to know that? And it's, to me, it's aligning them to know what the real world is after they step out of the school and knowing what they're going to step into. And hopefully where they're stepping into is following the guidelines and processes. But at least they know that they're doing the right thing themselves.
I think my concern for a lot of this, though, is you don't know what you don't know, right? And so
Yeah.
how do you, how you're expecting these people to just go ahead and like, go to an evolution or go to a, career fusion type thing or go to whatever, but they don't know that a lot of these things exist. Like they buried their head in the sand. They don't know. And so there's not really a way. I'm just trying to think there's gotta be like, if we're a solutions based group, like, is that something like in our state laws, right? We have certain requirements for CE. They say, okay, in some states it says you have to have it live and in person. Sometimes you have to have, 1 hour of human trafficking, 1 hour of local anesthesia, whatever. And I'm wondering if there should be something where it says in your first 5 years, X, Y, and Z are required. And part of that maybe is you go to a, big conference somewhere and you take some business courses, or there's got to be something else here that we can do to solve the problem and kind of not force. I don't love forcing people to do stuff, but like really give them that push and that nudge to get outside of their own little, 2 operatory practice in Nowheresville. Like there's got to be something else we can do here.
It's a big question.
Yeah, that is a big question. You attend, these board review programs and you see the energy, you see the excitement, you see the enthusiasm. You also hear the fear because they don't know how they're going to they're already fearful because they don't know how they're going to work on a tighter time schedule. They're a little lacking some confidence. We know that happens in dental hygiene school.
Yes.
And so it's almost like it's not a class. I hate to say this to you guys, but for the DSOs, it would be a great opportunity to provide that mentoring chair side throughout the day. I don't think it's something like a career fusion. Career fusion built confidence. So those type of programs are great because that's where you get the confidence. But if you are fearful of your skills and how to get everything in a certain amount of time and still do a good job and still do it right without somebody standing over your shoulder counting your errors for you, my world, then it might be something that would look really interesting. If all the DSOs had this 3-month introductory program for new graduates, I don't know what you'd call it. But, yes, they don't know what they don't know because they're hygienists and they're not going to admit it. But, but at the same time, they're fearful.
Yeah. And I know DSOs do this through coaches and VPs. They go in, but a lot of them are really big, so they only have so much time. It's about, maybe it is, there has to be this interim. How like when you're going to become a surgeon, right? You become a doctor, you work in the ER, and then you have to do all these different things to find out what it is, what path you're going to go down. Maybe there's supposed to be an interim. Or maybe we should start partnering hygienists with the type of practice they're looking for while they're in school and start placing them before they're in school and hold the standards of the offices that are out there to offer the standard of care that they're supposed to. Because let's face it, it's not just the hygienist. It's when you get out and you get into a substandard office that don't come to our office because we don't upsell you. And so they're fighting the practice of what we now know about dentistry and how important it is to know all of these benchmarks. It's not just scraping everything off the teeth. So it's a really big problem, but I think it starts with educating the patient on what you should be expecting. So much more.
Yeah.
What should be and how we can help deliver that in a way that lives up to that standard. I don't know. That's just this perfect world.
Yeah.
What's interesting about all this conversation is, one, we didn't have a plan going into it, and then we ended up 50 minutes later, we're still talking about stuff. But two, this is the thing. This is, and I know again, the listeners listening to this podcast are the ones that are going to the conferences and the ones that are involved and the ones that are doing all that stuff. And I'm so grateful to have that as like a listenership. But this is the kind of conversations we have at the conferences. This is like after hours types of like we gotta do something. Like I would implore anyone, if you are listening to this, and you don't go to the conferences, you gotta go hang out with other hygienists, like be problem solvers, be motivated. Like as maybe cranky as some of us sounded on some of these points, like we enjoy this though. Still, we still love this, even though we're frustrated about some of these things. And I'm just very grateful that you guys are my friends and you guys are all on the podcast. Liz, if someone wanted to reach out to you, if they heard something on the podcast and that, hey, I need a little bit more information about this, how can they find you?
They can text me or email me. I guess
you want me to give out your phone number?
I guess not.
Don't do that.
How about let's do an email address?
Sure. It's L as in Larry, N as in Nancy, I as in Igloo, E as in Elephant, S as in Sam at perio-protect.com.
Rafael?
And you could locate me. I'll give you both because I love people. I love talking by phone. So my phone number is 781-606-2130. And you could also email me if you would like to talk, you'd like to type at mrdh1993@gmail.com. Reach out anytime. And I also have a Facebook page for Mr. RDH. If you're a male hygienist out there, you want to be part of a male organization, is at Facebook, Mr. RDH. Just go there and I'll accept you in.
And Jackie, no one wants to talk to you, so we're not going to put your contact information.
Yeah. If they want to talk to me, they're going to find me because they're just going to be mean.
Yeah. Oh my gosh. Well, thank you everyone so much for being on. This is great. We'll have to do it again.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.